Dr. Arua Igwe. I'm the consultant pediatric and minimal access surgeon at Evercare Hospital Lekki. I met Zoe for the first time after she was admitted via the emergency department on account of chest pain.
My name is Zoe Ekeminiabasi. I am 14 years old. I came to Evercare because I had a pain in the left side of my chest.
My name is Mama Ekwere, and I'm Zoe May's mother. I brought Zoe in because she was experiencing chest pains and had over over a year, but this one was a little strange. It lasted a little longer than usual, so I took her in for some tests. Eventually, we came into Evercare. That was the last week of June, and we saw Dr. Jeji at the emergency room, ran a couple of tests, angiograms, CT scans, etc. And of course, then met Dr. Arua because it was obvious that there was a mass in the chest.
He had me repeat the test I did in the other hospital I came from. She
had several investigations, including a chest CT scan, where we discovered a mass at her middle mediastinum. So on review with the cardiothoracic surgeon also, we discovered it's a mass that we need to remove, and we planned for a thoracoscopic removal of the mass.
I have been approached by my colleague at Evercare Hospital, Dr. Arua, who is a pediatric surgeon, with regard to a case of 14 years old Zoe, who has presented with symptoms of chest discomfort, and subsequent investigations, including the CT scan, confirmed presence of a mediastinal mass.
When I had my diagnosis, I was scared because at first I thought it was like a tumor and I'd die. The treatment options he told us was to pop the cyst and let the fluid run out, but then there was a liability that it was going to come up again. The second one was a VAT, video assisted thoracic. The third one was an open chest surgery. The treatment option we went ahead with was the video assisted thoracic surgery.
The diagnosis at that time was that it was a pericardial cyst that had some calcification on top, and so the options that were given were, as Zoe has said, there were 3 options. Now, we chose the VATS, and that was simply because I wanted something that was minimal, quick recovery, and then my dad's a surgeon, so I had a conversation with him, and he also was more comfortable with something that was less invasive with less risks than an open chest surgery would have offered.
She had thoracoscopic surgery. What I mean by that is minimal invasive surgery, where we use 3 keyhole incisions through which we removed the mass in the middle mediastinum. And we did this in conjunction with the A3C anesthesia team, which really gave us good, seamless anesthesia for the procedure.
We decided to work together and offered her minimal invasive surgery, what we call VATS, video assisted thoracic surgery. This is advanced technique which has been most commonly performed in Western world, but now we have facilities available to perform at our hospital.
Initially, yes, I was quite scared, but I think I was more comfortable when I understood that it was not that he was like one of the best in Lagos in Nigeria, and that it would afford her a very quick recovery so that she could enjoy the rest of her summer. So that's why we went with that.
What this means is that she has less, conventionally, this procedure is done through an open chest incision. However, at Evercare, we have the technology and the facility and also the expertise to offer minimally invasive surgery for these patients, thereby reducing the morbidity and occasional chest wall deformities that can occur following a conventional chest wall incision.
After my surgery, I woke up that same day in the evening and I threw up twice because of the anesthesia. The next day, I got better. I was able to eat the next day. The chest tube was removed, so my surgery was successful.
This is 9 days post-surgery, so roughly a week and a half. I'm happy with the pace of recovery. The wounds are healing. She's gathering her strength. She's walking a lot more, so it's obvious that her organs, internal chest, etc., are doing very well. And I'm very pleased to see the progress. I'm pleased that what I was told is what has happened. The recovery is like really quick and sharp, and I'm really happy that I chose Evercare, the VATs, and Dr. Arua and Dr. Harish. So thank you very much.